Over the past 29 years, I've delivered over 5,000 babies. I love bringing a new life into the world, and I also love women. And too many women are in crisis. Many times, due to poor support or other problems in their lives, they may think that the only option they have is an abortion. When they present to an abortionist, too often, these vulnerable women are steered toward medical or chemical abortion. Hello, I'm Dr. Ingrid Skop. I'm a board-certified obstetrician gynecologist. I graduated from Washington University School of Medicine a long time ago, and I've been practicing obstetrics and gynecology in San Antonio for 29 years. I am an associate scholar of the Charlotte Lozier Institute, as well as a member of the American Association of Pro-Life Obstetricians and Gynecologists. So a chemical or a medical abortion is provided with two medications. Mifepristone, RU-486 or Mifepress, is given and it blocks the progesterone receptors in the uterus. This cuts off hormonal support and causes the death of the fetus. It's followed in 24 to 48 hours by misoprostol or Cytotec, which induces contractions to expel the pregnancy tissue. But it doesn't always work. And if the tissue is not completely expressed, a woman is at high risk for hemorrhage or infection, and in many cases, she must undergo surgery to remove this tissue. Additionally, mifepristone works specifically on the blood vessels of the uterus in a way that increases the risk of hemorrhage. Both mifepristone and misoprostol impact the immune system, suppressing it, increasing the risk of infection. And finally, animal studies show us that mifepristone also increases the risk of anxiety and depression. Biased studies based on poor quality data published by the abortion industry tell us that complications of medical abortions are low. But better quality international records linkage studies and meta-analyses tell us that approximately 5 to 10% of women having medical abortions will need to have a surgery to complete the procedure. It takes far longer than a surgical abortion, with the average woman bleeding for 9 to 16 days and 8% bleeding for longer than a month. There's far more pain involved. Some women describe it as similar to labor. She often will visualize her developing child who is about the size and shape of a gummy bear at 8 weeks gestation. Complications are 4 times more frequent with a medical abortion than with a surgical abortion. If either component, mifepristone or misoprostol, is used alone, then approximately 20 to 40% will fail. If a woman accidentally ingests a medical abortion in the second trimester instead of the first, her failure rate is almost 40%. A long-term goal of the abortion industry has been removal of the FDA's Risk Evaluation and Mitigation Strategy, or REMS, which governs the use of mifepristone. This would allow prescription without an in-person examination, ultrasound, or labs. The FDA recently permitted removal of the REMS using the COVID pandemic as an excuse. This means that mifepristone can be prescribed by telemedicine, ordered over the internet, and delivered by mail without a provider ever examining a woman. The eventual goal will be over-the-counter provision of medical abortion to women without any supervision at all. A chemical coat hanger, exactly what Roe v. Wade tried to prevent. The potential for misuse is high when there is no way to verify who is consuming the medication. This will clearly benefit sex traffickers, incestuous abusers, and coercive boyfriends, but it will not benefit women who desire their children. And finally, catastrophic complications can and do occur. These unsupervised medical abortions are being promoted to women who live remote from medical care. This is precisely the group who may suffer serious complications or even deaths when they have excessive bleeding, infections, sepsis, or other known complications to the medical abortion and no access to medical care. Because the federal government and the FDA no longer choose to protect women by enforcing the REMS restriction, it is my hope that the Texas legislature will step up and require in-person physician supervision of women undergoing dangerous chemical abortions.